And welcome back. We're about to venture off into our second segment for the morning. It is Open Your Eyes live on 5. Now, in our second segment, we'll be discussing with the Chamber of Commerce introduction to safety and health at work. This, of course, a training. It's just the introduction at this particular point. Now, in with us is Yorshabel Katous, who is a manager, member relations at the Belize Chamber of Commerce and Industry. Very pleasant morning to you.
Good
nice
morning.
to see you.
Yeah. Nice to be here.
Loving the yellow.
Thank you.
So, training, introductions to safety and health at work. I think this is a very important topic. And it's definitely something that all businesses should try to get at. Reason being is because safety, health, that's priority. It's primary. Let's jump on into this. How did this come around, the thought of even trying to get this rolled out in workplaces?
Okay, so it's a very important topic. Yeah. I agree. And it's not the first time we've rolled out something like this. We've had safety training. Yeah. But what's unique about this is that it follows the module from the International Trade Center that is run by the International Labour Organization. Yeah. So this course is just one of 27 courses under an essential, it's an essential package of all other related topics for safety and health. Yeah. Now the Chamber, as you may know, is the employers organization representing ILO in this country. We, the country, Belize, is a member state, one of 187 other member states of the ILO. Belize has committed to implement occupational and safety regulations in some manner so that we could protect both everyone at work.
Yeah. Now, I wanted to start off there because we haven't had the conversation about the OSH bill for a while, and we know that when it comes to the ongoing conversations with the unions, with the private sector, and also with the government, that there were concerns about rolling out occupational and safety health regulations because of cost concerns, because of the implication in just being able to get the resources, in getting the proper training, and all of these other things. Where are we now? It seems if you're having this event in conjunction with the union, it seems there's some compromise or some middle ground being reached.
Well, OSH, we've been silent about it. People have been asking.
Yeah.
In 2014, you know that it was passed. There was a first reading. Yeah. It's a draft bill. The first reading was done in 2014, January 2014. And usually for a bill to become law, it requires 3 readings. Yeah. So we had the first reading, then we had a series of consultations. We, the Chamber, we also have an in-house labor sub-council committee that reviews all labor-related suggested and amended policies, legislation, and so forth. So we've went through this bill and we have consulted with our members and to find out how they feel and so forth. And if I could go back with the ILO, being that the country has this commitment, there's a system in place. There's a committee of experts from the ILO who yearly review and find out what the member states are doing in terms of what they've signed on. So if you don't meet up to the measurements as to what you have agreed, you know, they come and if they find out why is that so and so forth. And they also, the good thing about it, they give you technical support. So this training, as I mentioned, it's part of a package from the ILO. It's training that I have received. So the Chamber is accredited to deliver this training. And the reason it's very important is because of that entire bill, the 72 pages, there are certain things in it that we believe employers, even domestic workers, because it goes also into your homes, would not be able to live up to it. So with the training that ILO has given us, it's helping us to, as it says, introduction. Introduction it's not really that basic, but it's just important things, and you might think it might be small, but it's important things that we could put in place now. We can start putting in place in our workplace, so that when we do have something legislated, we would be able to meet the standards.
So it's a bit of sensitizing your members to understand the depth of occupational safety and health in the workplace before we move forward with the legislation. We were supposed to be joined by Mr. Mora from the union. How are they, what is their stance with this process? They seem to be on board.
Yes. So safety and health is both for employers and employees.
Yes.
We both need each other. A business cannot run without the employees, and it cannot run without the employers.
Yeah.
So it's both important. And the union, we have sat with them, and right now we're in the making or the forming of a committee to actually come together and review it. We've done our part, our homework, and they've also working on their part to dissect the pieces and to see when we do have the committee and the sitting down what is amenable for both of us. So at the end of the day, we have a legislation that is not onerous to one party or both parties, but it's workable, because safety and health, it shouldn't be something that you'll say is stress or is strenuous. It should be something that should be protecting and be good for both parties.
Well, you want healthy and safe employees, because then you can have more productivity as well. What do you find to be, do you think that in terms of some of the businesses in their perspective of occupational safety and health, that perhaps they don't understand the full gamut of what it entails?
Yes, I believe so.
So everyone thinks it's just hard hat and reflector vest.
Reflector vest.
Yes, and you have to go and buy those expensive boots.
Steel tools.
Yes, and all those things.
But that's only one element.
So that's why this workshop goes down to the very essential things that you need in workplace, from basic your workplace.
Ergonomics.
And like for me, I've seen it so important, because without practicing basic things in safety, I have personally have to pay it physically, going to a doctor and so forth. So the training shows like just basic lifting a box. How to lift a box so that you don't strain your back. Because then the bill will be very high, and some back injuries are not repairable. So that's
and if you're in a heavy lifting company, who trains them how to carry things? If that's a part of their job requirement. When you think of, for example, we use ergonomics as one example. Imagine if workplaces across this country had to suddenly think of whether or not the workspace that their employees at is suitable, and that's from a chair that's the right height, desks that are right height, keypads that won't strain wrists or arms, and even the location of your monitor for your neck placement. These are just, and this is a part of occupational safety. When you think of, but we're not there yet in terms of rolling it out. So when people hear this, they'll say, "Oh my gosh, I have to outfit my entire office all over again. I've never thought of that."
And the thing is that we have new people coming out of the schools, and they don't teach that ergonomics. So when you come into your workplace, as you asked before, who train your staff? You just throw them behind a desk and say, "This is the work." But the slouching and the level, everything you explained, it does affect your performance, and then you have a lot of call-ins, and it trickles down to even the claims from the Social Security.
But of course, and speaking of that, there should also be breathing exercises as to how you're breathing when you're sitting down, which causes the back spasms as well. So all these things comes into play. But when I hear safety and health, we're talking here and listening to know now a little about what's going to take place at the introduction. What about mental health? There are a lot of people who are actually going into a workplace, probably suffering with some sort of mental health disease. Now, are these things going to be tabled at the introduction as well?
Not to that detail. As I said, this is just one of 27. There is a session only on mental health and in stress and so forth, because safety and health doesn't only affect the economy, but it affects you mentally, emotionally, your family,
of course,
everything. And actually, there's part of the session, it shows some statistics globally, what's happening data from the ILO, and there are about like 2.8 million people who have lost their lives either because of stress, basic thing as stress, or because of other work-related diseases, and even working very long hours is an issue. And so that's 2.8 million around the world who are missing from the workplace.
Wow. Wow. That's those are alarming numbers.
So what is your hope in this workshop? I mean, what do you want the members who participate to walk away with?
That is very important to practice safety and health in your workplace. You don't have to have a fancy policy, and we don't have to wait for legislation to come for us to start practicing now. There are simple things that we can do, and as an employers organization, we want to educate and capacitate the business employers, the supervisors, so that they can take note of these things so that they could have more productive workforce. Part of the session, it talks about risks, hazards and risks. And risks, if there's something an employee noticed that there's a risk, they're supposed to report it to their supervisor. And the supervisor is supposed to take action, immediate action. And there's part of the module that the action involves you actually go to the area where the risk is a
risk-prone area.
Yes, you go to that area with your staff, and you evaluate. It's a risk assessment. You come up with solutions, and you involve the employees. And then you put different things in place, and you actually evaluate to find out if it's working. And if your employees are not listening, you know, you have to stop work completely and start over. It's very important because it can cause the loss of a life.
Yushabel, you know, I think sometimes the perspective that employees have is that employers don't want to invest in a safe space. You know, they're always thinking bottom line, and if you're an employer, you can understand why, because they have to meet salary payments as well. But let's say it's something simple as ergonomics. It's the leveling of the materials that you're working on, which can have severe impact on your physical health. You can't go to work because you can't stand up straight, whatever it is. Or it could be a health issue. It could be dust or mold or whatever it is in your office. But very often, making it an issue doesn't necessarily equate into action. So I think from an employee standpoint, they just feel helpless. This is my job, this is what I have to do. Do you find that to be the sense for employers? Are they willing to pay to ensure that the work environment is a safe one?
Yes, there are good employers out there. And there are employers, when we were doing the consultation with the whole bill, we had different employers who came and shared their experiences and so forth. And some employers, especially those in the industry and the manufacturing, they have invested a lot in their employees, providing.
Some companies get it right.
A lot of money. But you don't have to have a lot of money, as I'm saying. With this course, it will tell you that there are some basic things that you can do. You don't have a lot of money to practice safety and health. And we are hoping that with this training, you can also understand that safety and health is a good investment, because then, as I said, you shouldn't have employees missing. It's a motivation for them to come to work, to see that your employer really cares about you and your well-being. And I remembered I had 3 trainers, one from different parts of the world, Russia, Syria. These are places that are big into occupational safety and health, because they do a lot of mining and gas and so forth, so it's very important to them. And one of my trainers, he mentioned that it's worth it to invest in your employee, because if you just one wrong move can maybe ruin your entire life. For example, with the back. And how much you'll have to spend, thousands of dollars to just fix that issue. You can't even fix it. Just sometimes you get surgery, but after it, you're not good to live.
You're not able to.
So are you willing to maybe spend maybe 20, 30,000 compared to buying a nice chair, or even practicing the right way? I mean, compared to, if you look at a chair, maybe $100 or something, you know, just like spending a few dollars, that would...
So before it's actually legislated, if people know this is what it will entail, they can make changes as they go along. So every time you replace a chair, you make sure it's an ergonomically safe chair, and your desks are outfitted for what they're supposed to do. So it could be gradual. Yes. But I know that this is, as you said, it's something that we are supposed to uphold under our ILO agreements, that the bill has been introduced. So it seems that this is a first phase, but what happens after this?
One thing I wanted to mention about the part with the investment is that we've noticed the concern that sometimes employers they invest, but then the employees don't take care of the equipment.
Yeah.
So I just had to put that in because it's very
important.
Or they
don't use it.
They don't use it, and then they harm themselves. So the training shows you that it's very important. It's for you. You know, it's important. So what happens next is that we're in the Caribbean. There are other Caribbean countries who, you know, they don't really have a legislation. I believe Jamaica is one. But what they do have is they have a body association, an active body. They have inspectors and everything. So with us, we're looking at the legislation, the drafted, to see what is possible for us. You know, so that what is easier for us to implement. That is something that you could just implement now and it's strenuous. And what we could implement in phases. Would it be sectors? We can look at data as to sectors that are really affected and see if we can target them. So
I think when it comes to this entire process, it is supposed to be across the board that employer and employee are supposed to be together as one. We're supposed to be able to watch each other in the eyes. Now, just listening to it, I'm wondering here at the introduction, will they be able to tell employers that you're able to ask questions when it comes to safety? Yes, you don't want to spend the money on getting, you know, all the health aspect into your particular spot because it's too expensive. But at the same time, employers are liable in the event an employee gets hurt on the job. So will it be thought to them that they're able to ask questions? And I think this is very important because for the most part, you get to a job and you're not sure. So you just sit down, you do what you have to do, and then you leave at 5 o'clock. At what point should we ask questions?
At the very point that you see there's a risk. At the very point. And sometimes where employees might be intimidated to ask questions, but there might be tools available. And for example, going back to lifting, because that's a very important one. Maybe it's something too heavy, just simply asking someone else to help. And
if the load is too big for you, you should ask.
You should ask. So, and then, go ahead. So with liability, it should go both ways, because remember, it's a responsibility of everyone, employers and employees. So this session should educate you that these are the resources you have gotten to protect you and the entire workplace, and even those customers who come to your, because sometimes they are at risk too. So it's not only those within the workplace, but those that come and visit the workplace. So if you're not, you should be held responsible to take care of whatever items in your workplace. So it goes both ways, employers and employees.
I mean, there's a reason why if you're in the States and they're mopping an area, the entire area is cordoned off. They don't want anybody falling. And that's workers and customers, because there is liability there. And I think these are the things that we take for granted. But what you said, I think, is very important. It's a partnership, because where a company does provide, or an employer does provide tools for safety, an employee has a responsibility to use them as well. So the introduction course is perhaps your first step in getting everybody aware of what all it entails. Is it open to members only? Is it open to people who are just interested in learning more? What are the specs?
Yes, all our trainings are always open to non-members. Yes, we are a membership organization, and our members, our employers are first, but on the overall, we represent private sector, so it's our role to open it and educate those that are not members. So we do have even those from the government, we have the Labor Department participating, the trade union, so that we're at one place and we get the same kind of knowledge.
Yeah, yeah. So it's going to be, it's actually today. Today's the 20th,
Yes.
at the BCCI McField Conference Room. At what time?
8:30.
Oh, that's a direct.
That's now.
We're kind of full. We have about 40 persons or so,
Nice.
but we should be having repeat. And as I had mentioned, this is just one of the 27. So we have other courses we want to
Wow.
bring. There's one with fire, and I really would like to
Yeah.
do that, hopefully in October, and also have the fire department.
Yeah.
Yeah.
On
Yeah.
board.
Yeah.
Yeah. How many people think of fire exits? That's another
That's true.
story.
That's true.
Well, Yorshabel, I think clearly it seems that there are moves being made in terms of ensuring that we take occupational safety and health a lot more seriously than we used to. And it seems that there is progress in having the private sector and the unions coming together to ensure that more people are aware. So thank you. And if people want to know about the other programs that will come out, how do they find out?
So you can either call us 223-5330 or WhatsApp 614-3138. That's our work number. Or email us bcci@belize.org or stop at our office. We're right down here at Coney Drive in the Whitfield Tower.
All right.
All right.
Thank you.
Thank you, thank you, thank you. And we're about to take a break, but one of the things that we heard earlier was one child asking his or her parents for a bottle of detergent for Christmas. For what? To make slime. Wow. In our next segment, Belize Camping Experience will teach us how to make slime. Stay with us, we'll be right back.